Welcome to another episode of Caffeine Chaos and Critters. My name is Kaitlin, and my beverage of choice today is another poppy.
My name's Justin, and I'm drinking another lavender oat milk matcha latte.
Yummy. Alrighty. Well, today we once again don't have a listener story.
Insert
Reminding everyone
here.
again that our email address is vetmedpodcast@gmail.com. So please email us if you have questions or topics that you want us to bring up or talk about, or if you just have a really funny story from working in the field, and we'd be happy with any of that. However, since we don't have a story, we are just going to do our veterinary news segment. And there were a few things that I wanted to bring up. One of them is still relevant, but technically I'm a few weeks behind on this, but just wanted to touch base on it in case people hadn't heard of it. And that is just the equine herpesvirus outbreak that has recently occurred. They've seen 60 cases in total, I think in Arizona, Colorado. Where was the other one? I'll tell you in just a second.
I guess I didn't even know that horses got herpes.
Yeah, but it's not great. So Arizona, Colorado, Louisiana, New Mexico, Oklahoma, South Dakota, Texas, and Washington. And 47 of those horses are showing neurologic signs. So if you didn't know, equine herpes virus is an issue because they can have neurologic signs associated with one of the strains of the virus, and it can be deadly for them. So it's definitely important to, if you have an outbreak in your state, make sure that your horses are staying isolated, that if you have friends that have horses that have maybe been to shows or rodeos or places where we know there's been an outbreak, just make sure they're not coming onto your farm or land or wherever it is that your horses are kept without properly sanitizing their boots, their gloves, their riding gear, all of that, because it can live on those surfaces. So just make sure you're properly sanitizing, and that you're not going to places that are overly crowded with your horses if you are concerned about it. It says that it can persist in the environment for up to 21 days, even in wet or shaded areas. So it's just really important to be aware of that. And obviously, if you work in the field, just familiarize yourself with the clinical signs, the symptoms, that if you're seeing that in patients, you can identify it right away and make sure that you're also preventing spread as a veterinary professional. The next thing that I wanted to talk about in veterinary news is something that I hate more than anything in the whole world, and that is screwworm. If you don't know what screwworm is, basically it's kind of like a botfly, but botflies burrow into the skin. You can kind of pop them right out. Screwworm is a little different in that it quite literally is in the shape of a screw and it like screws into the skin. Um, it's disgusting. It can also happen in people, which is why it's a huge issue if we're seeing it. It was eradicated in the United States, so it currently is not here, but it is in Mexico, and they've been seeing a trend of it moving north. So they are worried that it could come back to the US. And so the FDA has issued an emergency authorization for the anti-parasitic use of a drug for dogs and cats, Credelio. There's a dog and a cat version. So if need be, if we see it, there is a drug that they kind of authorized for us to use to treat it or to get rid of it. And again, that is Credelio. If you see screwworm at all, it is reportable. You need to report it. So call your state vet right away if you are concerned.
Hmm.
But
I've
yeah,
never even heard of screwworm before.
oh my God, you have to look it up. It's disgusting. Yeah. But that is the news for today.
Well, I wanted to give an update.
Yeah.
So, you know how last episode I was talking about the diffuse iris melanoma in cats? I actually had the opportunity this last week to kind of like warn a client about it because I had noticed that their cat had some pigment changes in its iris, and I was like, might be worth monitoring. And if it increases in size or darkens or takes over your cat's eyeball, you might want to see an ophthalmologist. We
Oh my
have one next
gosh.
door.
You're like, I swear I'm not just promoting it.
Like I swear to God, it happens. It happened to my cat,
Yeah.
and I have to
No, that's
monitor
really
his
cool.
eyeball. But yeah, it was kind of
That's
just
really
like a
cool.
cool like connection I made after the episode.
I love that. Now you can watch for it in your patients and tell owners about it. Could be something even that the doctor misses. So good to be aware of.
Well, it was also like so small that I think I just happened to notice. It had like 3 or
Because
4 like tiny spots. But I think I'm hyper aware of it because my cat has it.
that makes sense. I could see that.
So, yeah, it was just like a cool connection I wanted to relay on this episode. Also,
Yeah.
happy new year to everybody. Hopefully you had a
Yes,
really
Happy New
good
Year.
New Year's Eve. Got to kiss your loved one if you have one. And
Yeah,
if you didn't, maybe you kissed a stranger. I don't know. It's your life.
yeah. Enjoy
If
it.
I was single and I was at a bar, I'd probably kiss a stranger.
Yeah, I don't know. I've been in a
Caitlin's like,
relationship my
I
entire
wouldn't.
adult life, so wouldn't be me, but that's okay. No judgment from me to anyone else. Well, the things we wanted to talk about today, I was just going to talk a little bit about vet school, my experience, and things to like personally maybe not do if you are looking to get into vet school or you're applying to vet school or you just started. Just because I've worked in the field for a very long time prior to going into school. So my experience in the field, my experience with burnout, um, and then my experience in school, I think I just have a different like view on it that I think would actually be very helpful to other students. So I just wanted to throw out some tips and just talk about that a little bit. And then Justin's going to talk about over the counter medications for pets, like do's and don'ts, things to avoid as a pet owner, and things we should absolutely not be doing without the consent of a veterinarian. So, yeah, going to be a fun episode.
Period. So the topic I wanted to touch base on or talk about today is like over the counter medications. I've just seen like some content on the internet that is very concerning, and one of those being the video I talked about last week or 2 weeks ago, whenever we posted about that owner that was like giving their dog some over the counter like Toxaban basically due to them ingesting grapes. But there's just like so many over the counter medications, and I can't even count how many times I've had owners call the clinic and you talk to them and they're like, is there anything I can do at home? Like, what can I give them from home? Unfortunately, there is no safe over the counter pain management for pets. I will say that I also want to preface this whole bit with I am not a veterinarian. This is not me telling you that you can or should give these medications to your pets.
Yeah, this
I
is
am
not
just,
medical advice.
yes, this is not medical advice. I just want that to be very clear, and I want that to be just known that this is not me giving you medical advice, and I'm not telling you that you should give these medications. But there's unfortunately not any over-the-counter pain meds for animals. I know PetSmart and Petco sometimes do sell these like bottles of over-the-counter pain reliever for dogs or whatever. I'm pretty sure it's just aspirin, and although aspirin is technically does have a therapeutic dose for animals, it's not recommended to be given to pets unless your veterinarian prescribes it to you with a safe dose.
Right. And I think it also should be known that aspirin is often used as an anticoagulant drug in humans as well. And if you're giving your pet aspirin for a wound or something that has like traumatically occurred to your pet because you don't know when you'll be able to take them in or you can't take them in right away, you can negatively impact their healing by giving aspirin. So just also be aware of that. If the doctor has to perform surgery or a procedure on your pet after you've given it aspirin for several days, it is an anticoagulant. It makes it more likely that they're going to bleed during the procedure. So just something to be aware of too.
It's a good point. But no over-the-counter NSAIDs. Do not give those to your pets, especially not your cats. Feline
Ibuprofen
patients
is the big
are,
one.
yeah, like it kills cats.
Yeah.
Ibuprofen has been through a lot of clinical studies with dogs, and it is actually becoming a little bit more prominent in the veterinary field. Like there are some facilities that do prescribe ibuprofen for your dog after surgeries and things. It has been kind of studied to cause less issues than like even Rimadyl does. But again, it should only be given if prescribed by a veterinarian because the dosing is different than what it says on the bottle, and you can cause permanent damage to your dog's kidneys. So the main thing with this is just like don't play pharmacist as an owner. You should just be seen and prescribed medications by your vet.
Yeah.
That's
Add to
like,
that, To
go
add
ahead.
to that too, I'll say again, there are medications that can be given to pets that are technically made for people. Lots of them, right? Obviously, there's lots that you have to have a prescription in order to get even as a person. I've seen Tylenol used. There's allergy medications that have been used. Like you said, ibuprofen has been used, things like that. But like you said, the dosing is different. And when we say the dosing is different, that doesn't mean you give a quarter of a tablet of your ibuprofen to your dog who only weighs 10 pounds. When we say the dosing is different, we mean they metabolize the drug differently. And so, even what you would think is a very small amount of ibuprofen, you can give that to your 7-pound cat or your 10-pound dog and seriously do damage because that is not even the teeniest part of that tablet can cause issues. And it needs to be a much, much lower dose and it needs to be appropriately calculated because, again, there are drugs that they metabolize differently, and that is what we mean when we say the dosing is different. It's not just, oh, you need to give a small amount to them. It's like the, amount of
The
times per day we can give
pharmacokinetics
it.
of it.
It's how many days in a row can we give this without doing damage? Like how often per day? What is the actual, like there's a lot that goes into that it's a lot more than just saying cut the tablet in half and give it to them. That is not at all what we mean when we say the dosing is different. So please do not interpret it that way. That's all I have
Yes.
to say.
I also wanted to bring to light just like a conversation about like flea and tick preventative. I know that a lot of those are over the counter, but if it is not labeled for a cat, because there's some like flea and tick preventative that's safe for a dog, but if you put it on your cat, it causes serious neurologic issues. I've seen cats who have gotten flea and tick preventative and they come in like actively seizing, and it's like you can't stop the seizures. It's really, really bad.
Yeah.
So ensuring that like you know what you're getting and you're reading the labels and you're determining whether this is safe for dogs or cats or both. But that's a big one. I also kind of wanted to talk about some things that are safe for pets. Because we do, like Kaitlin said, use a lot of human medications in veterinary medicine. I think some people are kind of baffled by that because I'll be like, oh, yeah, you could just take this prescription to a human pharmacy and they'll fill it for you. And they're like, wait, what? There's very few veterinary specific medications. Like we do have them, they do exist. But majority of the medications we do use in VetMed, we're buying from human medicine. Like they mainly make meds for humans. So there are a few medications that you can give over the counter that are safe. Again, I'm not telling you that you should give them. I'm just giving you examples. Famotidine being one of them. Famotidine and omeprazole are both acid reducers that we use quite regularly, actually. Well, they're also like just GI protectants specifically, but they're acid reducers essentially. Benadryl is one that we use pretty regularly that's also safe. And then one of the other main ones I wanted to go over is probiotics. You can buy some actually really good probiotics over the counter. One of them being Proviable is a great one. You can buy it at Petco and PetSmart, and they come in like the kits that have the capsules and the syringe of like the gel stuff. They also have those like DC capsule, which are basically just the capsules itself. And then Purina actually makes one called Fortiflora, which is really awesome. I really like that one specifically.
They also have the stress Fortiflora, which is like specifically designed for pets who have stress.
Yes. And that's a very common thing, especially in dogs, because like a lot of them do show their stress through having diarrhea and gastrointestinal issues. That's one of the reasons I think why we see it so much in ER is because they just get diarrhea with everything.
True. I mean, people get stress diarrhea too, just saying.
See, but cats I feel like don't really.
They
Cats
just
get stressed
won't
and they
poop.
piss everywhere.
Yeah. Or they just won't poop for like days because they don't feel safe enough to poop,
Yeah. But let's see. There are some other allergy meds that we also will use over the counter. What are some of the common ones that you've had scripted out or like told to owners to give?
Allergy meds?
Yeah, like other than Benadryl.
Think like the regular, what's the name of Zyrtec? Like the actual name.
Is that Claritin?
No, that's another brand. Let me look it up.
No, I think Zyrtec's a brand name.
It is. Claritin is as well. Cetirizine. That's one that we prescribe for dogs.
Yeah, we'll prescribe that for dogs who have like chronic allergy issues. But I just kind of wanted to go over all the things that like you shouldn't be doing, things that are safe, obviously under the supervision of a veterinarian, but mainly just to educate people on the dangers of trying to use over-the-counter meds. This kind of all stems from my conversation last episode because we had that puppy story that I talked about where the owner was like treating this puppy. And so I just kind of wanted to emphasize on what is safe and what isn't, and the fact that you should always just consult with a veterinarian if you have any questions or concerns. Our main interest is your pet's safety, so we will always give you the information that you need.
And that's the thing, right? Like I think people just assume you're telling me not to get these over the counter meds because you want me to come in and pay top dollar for some other medication that you have, even though this one works for my pet. And that is not true. It is that we are concerned about the safety. And if you are absolutely insisting on giving an over the counter medication, at least talk with your vet and say, I'm going to give this, and let them give you an appropriate dose of the medication, how often it should be given, and what signs to look for when to stop it. Because if you're insisting on giving a medication, just be upfront and be honest with them about it so they can at least let you do it safely. Because otherwise, I mean, yeah, it can cause serious effects. I did want to circle back to your flea and tick preventative conversation as well, because it is really important that we don't give cats, like you said, dog, flea, and tick. But the other thing that has become popular in recent years on like holistic TikTok and Instagram is tea tree oil. And I want to
Yes.
emphasize that tea tree oil is extremely, extremely toxic to dogs and cats. It will cause death. If you just put straight up tea tree oil all over your pet, you can and very likely will kill them. It has to be diluted to like 0.01% in order to even be remotely safe. And even then, you're taking a risk. So please, for the love of God, do not use tea tree oil products or straight tea tree oil on your pets for flea and tick preventatives. Because while it may deter the fleas and the ticks, it is not safe for the pet. So please don't do that.
Essential oils
And
in
that's why.
general are a no-go.
Yeah. Yeah. There's very few of them that are just like safe to be used on your pets. And even then, again, need to be diluted heavily in order to do so. So it just is not worth it. And
I
if
mean,
your
you have to
pet is
dilute
suddenly
them heavily
having,
before you put them on yourself even.
or you should be anyway. Yeah. So anyway, I just wanted to throw that out there because I know there was like a trend of people saying it was like the next best thing. Just put a few drops of tea tree oil on your pet and they'll be okay. Please don't do that. It's like, it's one of those things where like people are like, oh, it's more natural. It's not a formulated medication that someone's prescribing me. So it must be better for my animal. When in reality, they're putting something that's extremely toxic. While it may be natural, it is extremely toxic to the animal. It's just like going out in the woods and eating a toxic berry and saying, but it's all natural. So I'll be fine. Like that's like literally the same thing. Those two like scenarios are the same thing. You can't just do that because it's natural. It's still toxic. So like in this case, using a prescribed pharmaceutical would be safer for your pet than using tea tree oil. Far less toxic.
Also, I don't know, I am not against holistic medicine.
Me
I
neither.
just wanna say that I am not an holistic hater. I don't hate Eastern medicine, but I am so sorry, but I do not think anybody should be treated 100% with Eastern medicine. I think they work really well together, Eastern and
I do
Western
too.
medicine,
I tell
but I
people that all
don't
the time.
think
I'm like, they can work together. We don't need to work against each other.
yes. This is just like
Yeah.
kinda like that whole theory in humans where it's like science or church, you know? Like,
Yeah.
why can't people just, like, be okay with both or try and
Exactly.
merge them into one
We
thing?
don't have to
Like, why
like
does it have to
create this
be
like,
such a battle between the 2? There's such a divide,
yes, I agree with
and
that
it's
100%.
so
I'm so with
frustrating.
you. It's so frustrating. Cause like I was just thinking about this the other day, and there are so many things that I would consider super helpful that people consider like holistic. Like
Mhm.
laser therapy, acupuncture. There's so many different like therapies that can be used for animals that can help with pain management and mobility and recovery from surgery that don't involve pharmaceuticals, right? And people would consider that holistic. I would consider that like the best medicine is doing pain management, and all of those things combined would be like the best possible scenario, right? For the pet. But I just feel like people don't like. I remember one time I had a Frenchie owner come in. We diagnosed the Frenchie with IBGD. It was paralyzed both hind limbs. And usually when they get to that point, we say, you can do surgery. It may or may not work at this point, or you can do medical management, physical therapy, all of those things and try it that way. Well, this guy was going off on the doctor about like surgery and pushing surgery and like, I don't want to put my dog through that and all these other things. And I remember I came over and talked to him and I was like, if there was another therapy that you'd be willing to put your money into and try if you don't want to do surgery, is that something you're interested in? And he was like, yes. So then we talked about it and he's like, oh my God, I saw videos online of people doing this with their pets and acupuncture and all these things. And he's like, yeah, I've seen videos online, and yeah, where do I go? Where do I try that? And it's like, again, would surgery maybe be the best option for this pet? Sure. But if an owner is not willing to do surgery or is not willing to go through with that process or maybe wants to try something a bit more natural, I'm not opposed to encouraging them to do that because it's better
Yeah.
than doing nothing. It's better than
Yeah.
doing nothing. But again, back to the same conversation, you have to be safe about it. You have to do it in the correct way. You can't watch YouTube videos online with your dog who has a serious injury to its back and do mobility exercises at home. You need to go to someone who is trained on that and can actually appropriately help your pet. So again, there's just like this fine line of people thinking holistic is just simply not seeing a doctor, and I don't
Mhm.
think that's always the best route. You can work with the doctor and do holistic practices at the same time.
Yes. And I
I
will
just went
say
off on
that
a rant.
I do think medicine in general is going more to a mix, like, of Eastern and Western medicine. I mean, we
Yeah.
use Eastern medicine and VetMed all the time, like
Mhm.
acupuncture or physical therapy. I know some people may not consider that Eastern medicine, but it truly is an Eastern medicine practice
Yeah.
to do those types of things. Some other ones that we use really frequently is a supplement called Union Bio, which is amazing. We have an oncologist at my work, and so Union Bio is used a lot. Like, we send it
Yeah,
home all the time.
for sure.
Another one is like turkey tail supplements, I know are used a lot.
Yeah,
Turkey
I've heard
tail is
about
like a
that.
mushroom. I don't remember exactly what it helps with. I think it might be for bleeding as well, to be honest. I'm not 100% sure, but I
I'm not
know
100% sure either,
oncology
but I
uses
do.
turkey tail a lot.
Yeah. I think it's specifically used in cancer patients, but I don't know what the specific use of it is in cancer patients. I did recently, it's funny that you brought that up though, see a social media post that was for sure made by AI, like 100% made by AI. And it was just going off about how doctors want to do all these crazy treatments and medications and chemo when you can just use turkey tail and it's more natural and blah, blah, blah. And so it's funny that you bring that up saying that your doctors will give that medication out and recommend it to their patients. But again, it's in conjunction with other medical care that is most likely necessary for the pet. And so it's like these things can go hand in hand. And it's not that veterinarians are opposed to it because those posts are always designed to hate on veterinarians every single time. That's what they're designed to do. But it's just a matter of them probably not finding a veterinarian that meshes well with their personality or just choosing to believe shit that people say on the internet.
While we're talking about over-the-counter medications, I did want to bring emphasis to something that this is by no means like I'm not trying to sell you something. This is just a product that we worked with somebody who does produce this product previously, and we just like this product specifically because it is made by a veterinarian who knows what they're doing. It has proper dosing charts in there, and it's designed so that you use the medications appropriately, even though they're over the counter medications. And it's called Population Health is the brand. And it's called like an oopsie kit or something. What's
The uh-oh kit.
the uh-oh kit?
Okay.
It is something you can purchase online. So for people who are interested in anything that they can do at home, the Population Health uh-oh kit is like a good place to start. Um, I just want people to be able to make educated decisions and like use the medications appropriately. And I know that's a kit that has all pet safe medications in it, and the proper instructions to give it appropriately.
Yes. And I will say I've purchased one of these kits myself, and it comes with, like he said, it comes with a pamphlet that kind of goes over what's safe and what's not safe for your animals when you do need to go into the ER or see your veterinarian. It has some over the counter medications already in the box. So things like famotidine, there's a probiotic in there. There's a few others. I don't remember exactly what they are, but it comes with correct dosing based off of your pet's weight, size. So yes, there are things that are absolutely like available if you guys want to try something at home before rushing your dog in, or maybe you can't get to your appointment right away and you want to try something that's technically safe. It's not going to harm them in the meantime. And so the uh-oh kit is definitely one. And like Justin said, it is co-owned, I think, by a veterinarian that we both used to work with. She's an ER doctor. So look it up. Maybe I'll tag the page in the description of this so that you guys can easily find it.
Well, and if any of you have noticed, we did make a link tree And I did add.
Yes, we can add it to our link tree.
Oh, I already did. It's under our store. I added the link to purchase the population health kit, and it's in our store on our link tree if you want to easily access it.
Well, perfect. Then check out our link tree. We also have
Yeah.
Trupanion, the link to their website in there as well, since we talked about that in a previous episode.
Yeah. So if anybody's interested, let's see. I feel like there's maybe one more thing. I wanted to bring up antibiotic usage. This is a big thing. It's kind of a hot topic. And I think medicine and VetMed specifically is kind of gearing towards using antibiotics more sparingly and trying to be a bit better about our antibiotic usage, because for those of you who don't have a background in medicine or really know a lot about it, unfortunately, antibiotic resistance is real. And the more that we inappropriately use antibiotics, the harder it is to treat infection, because we start to make these strains of bacteria and viruses and whatever it may be. Not viruses, because antibiotics aren't used for viruses. I do know that. I'm not stupid, I promise. I misspoke. But there's going to be a lot more antibiotic resistant bacteria that are produced the more we inappropriately use antibiotics. So if your veterinarian is hesitant to put your patient or your pet on an antibiotic, I promise you it's coming from a good place. I don't want you to hate on them and call them names, because they are trying to do what's right by your dog.
And not just your dog, but
everybody in general.
For the health of all of the dogs and cats, and also for people. Because when bacteria resistance happens, it affects us too. There are infections that can be spread from pets to people. And if it is a resistant bacteria that you then spread to your elderly grandma, that's not good. So it is important that we be careful about our usage. And I also want to say there's a lot of movement towards using, for minor infections, skin infections, minor wound infections, there's a push towards using topical treatments like diluted Chlorhex and other things versus prescribing antibiotics. So you can do that for 3 to 4 weeks versus oral antibiotics, because it's much less likely to cause resistance. So again, like Justin said, the veterinarian is not being weird about prescribing antibiotics because they just don't want to help your pet. There's far more behind that choice than just throwing some antibiotics at your pet. Yeah.
And one thing that I do want to bring to light in this conversation that I think has had a bit of an uproar in veterinary medicine and from owners is the use of metronidazole. Metronidazole we used to hand that shit out like candy. Anything that came in with diarrhea, we gave it to everybody. Every dog who had diarrhea got prescribed metronidazole. But with new research that has come out and just clinical studies and so on and so forth, it has been proven that dogs who are put on metronidazole and have a diarrhea outbreak, and dogs who have a diarrhea outbreak and are treated more supportively, and by supportively I mean bland diet, probiotics. Psyllium husk is something that we started to use more often, increasing their fiber intake. Things like that have, essentially the research is saying that the diarrhea is resolving in the same amount of time for patients who are being treated supportively and patients who are being treated with metronidazole. So the theory, because of this study, is that what is the metronidazole truly doing that we can't get from another treatment that doesn't cause greater issues? So don't hate on your veterinarian because they didn't send your diarrhea dog home with Metro, and you got sent home with Metro 2 years ago and it resolved your dog's diarrhea. Why didn't they do it this time? It's because your veterinarian actually reads clinical studies and practices the best medicine that they can. It's actually a good thing. And I do just want to also bring this to the technician's attention. I think as veterinary workers, we should also be talking about this in the clinic. If you have a lot of veterinarians who are prescribing metronidazole, maybe bring up the conversation of hey, I don't know if you know this, but there was this clinical study that was done about Metro and saying that essentially it shouldn't be gold standard anymore to send that home with every dog that has diarrhea. Because not only are you helping the pet and you're helping the world as a whole by not overprescribing antibiotics, but you're also helping educate the doctors that you work with.
Well, not only that, you're helping the pet in the long term, because even a short course of metronidazole has like serious effects on the gut microbiome. It kills good bacteria along with bad. And so when you're giving these antibiotics, actually, I remember like, I don't know, 5, 6 years ago, doctors would give out like huge bottles of Metro to people that had multiple dogs at home, and they would just give it for 2 or 3 days at a time here and there. If a dog had an outbreak, people were using it at like boarding facilities, people were using it at training facilities, they were using it everywhere. And the thing is, it is not, while it does work to clear up diarrhea, it's not totally benign and it can have effects later on, and they can be more prone
Mhm.
to having diarrhea and GI issues later on because their gut microbiome has been basically destroyed by this medication, especially if you're using it here and there, off and on, whenever you feel like it. It can have like negative effects. So, just something also to keep in mind if your veterinarian has prescribed it or if you're choosing to prescribe it. Um, Especially in young dogs and young cats, when they're really young like that, they don't really even have a microbiome developed yet, and so like you don't want to destroy the good bacteria that they have at that young age before they even have a chance to
Mhm.
like develop one. So, yeah,
Period.
period. That's my
I mean,
spiel.
I can even say though, like back in the day, Luna, my dog, she's like a stress colitis dog specifically. Like if anything stresses her out to an extreme, she's like shitting blood. Like that's just her
Yeah.
life. She she gets GI upset pretty easily when she's stressed. And before all of this changes, she's been on bouts of metronidazole so much that just because she would get diarrhea so easily and so often.
Yeah.
But I will say that, like, when I'm trying to do things a little bit more holistically, and the longer that she's been not taking metronidazole, she actually gets diarrhea less frequently. I honestly think that, like, the amount of metro that I was giving her so often from her bouts of diarrhea was making her diarrhea happen more often, and it was like she was just having diarrhea all the time.
I could see
Um,
that. Yeah.
And now that I've been more holistically treating her and trying to manage her stress better, she's also on like long-term GI diet now. Like I have her on just like a low-fat, bland food all the time because she's just so prone to diarrhea. And all of those things have made it so she doesn't really ever have diarrhea anymore. And if she does, I know it's actually a problem and it's not just because I moved the
Right.
couch.
Yeah, no, I think that's a great example of it. And unfortunately, yeah, I've seen that a lot in practice where people just give it all the time and they're like, my dog has diarrhea constantly. It's the only thing that helps. And in reality, the thing that will help is changing their diet and fixing their microbiome so that they don't have the diarrhea anymore. Which there's a lot, I mean, there's a lot of good that probiotics can do over the counter, but it should be known that probiotics do not replace a natural, healthy microbiome that comes from diet, environmental factors, and probiotics. And so if antibiotics are overused, or if your pet has something where they have to be on antibiotics for like 12 weeks, which I've seen with certain things, like that has a serious effect on it and it may never completely go back to normal again.
Mhm.
Yeah, but there's still a lot of research being done on that. I know fecal transplants are like becoming a thing potentially to help with that too, but I don't know, we'll see. We'll see
The
what
thought of
happens.
fecal transplants just grosses me the fuck out.
Oh my god, same. They do it in people though. Did you know that?
Yeah, but just the thought of, like, putting somebody else's poop inside of
I
somebody,
know.
it's
It's
just
nasty.
disgusting.
It is nasty, but like it makes sense.
It does, I get it. I've never been a part of a fecal transplant since in my, like,
Me neither.
time in the vet field, but I think it would gross me out.
Same. All right. Well, now that we've talked all about antibiotics, we can move into vet school. Yay.
Yay!
No, I just wanted to talk a little bit about it because I feel like there's a lot of like, I don't know, there's just like nervous energy when you even bring up the word vet school. People are like, oh, it's so hard. It's so this, it's so that. And I am not saying that it's not hard. I'm not saying that at all. What I am saying though is that it can be manageable. And I think people just need to set boundaries a little bit. So I just want to talk about like my experience in the field, and like how it has shaped how I've been, I guess, surviving in vet school so far and how I plan to survive at least through this next semester. I just think there's a lot of comparison that happens with vet school, which is totally valid because in order to get into vet school, you almost have to compare yourself to others, right? The application process, the interviews you go through, making sure that you have all of these qualifications, that all of your classes meet their expectations, blah, blah, blah. So there's a lot that goes into applying to vet school, and a lot of it involves literally competitiveness in order to get there. However, when you actually get into vet school, like that competitiveness needs to leave. It needs to be left in the past. It's no longer necessary. I think comparing yourself to everyone around you, comparing your test scores, comparing the way you study, comparing how you spend your weekends, your free time with other students is not healthy, and it's not going to make you a better veterinarian to be competitive or to compare yourself to others. And so my advice is just stay in your own lane, study in the way that you feel is beneficial to you. Don't study the way that your classmate studies just because you think it looks more aesthetically pleasing. Just do what works for you and focus on what works for you. Don't focus on what works for other people, because it is different for everybody. And I really think that like comparison and that competitiveness only leads to more stress in a program like this. It's already stressful as it is. It's already a lot of work. It's already going to take, I mean, sometimes it's 12, 13 hours a day for me between classes and studying. Like it's a lot. And if you add into that, well, now I need to do X, Y, and Z because this girl in my class is doing that. Obviously, I need to be doing that. That's not true. If you're still getting good scores on your exams and your practicals and you're still understanding the material, you don't need to do those things. There's no point in working yourself to death because somebody else in your class is doing things differently. And I say that because I have seen it in my class. I have seen students do that. And so I know that the comparison thing is hard to overcome, but I really think you have to drop it. The moment you get into vet school, you need to drop it. And I am attempting to follow that advice myself because it's hard sometimes to not be like, oh, well, I wish I was that smart, or I wish I had studied more for this, or I wish I had done this like that person did, because look at them, they're better prepared for class than I am, or they did better on this test than I did. And I think a great example of that is that one of my classmates they started studying for our final probably 2.5 weeks before the final and studied every single day over and over and over again with this material. Studied with a group, studied by themselves, tried all these different things, really stressed themselves out over this final. I waited until like 3 days before the final because I was like, I've been studying this information. It's been building on itself all semester. I know this. It's not like I haven't practiced it. We haven't gone over it a million times in class. Like for me, I didn't want to extra stress myself out because we had a million other things going on. We had OSCEs, we had exams, we had final projects. If I had dedicated a full 2 weeks of studying every single night for this final on top of everything else that was going on, I would have really burned myself out, and I know that for a fact. So I waited until all of that stuff was complete. I had time to focus on it. I studied in the way that I know helps me learn, and I didn't spend an excessive amount of time on it. And even though I was kind of nervous about doing that, I got 100%. So I think that just proves that you don't necessarily need to overwork yourself. And sometimes going over that information over and over and over and over again, when you know it, actually makes it a little bit worse. You can confuse yourself sometimes by like just diving into it a million times. And I know people in vet school are all type A. Most of them are type A. But I think having that boundary and letting that go a little bit can actually be beneficial. And I think you can give yourself a little bit more confidence that way too, by just saying, it's okay. I know this. I don't need to go over it a million times. So that would be my suggestion there.
I just wanted to say that this is also super beneficial information to take into practice too. Like even as a technician, there's such like a toxic work culture surrounded by competitiveness and comparing yourselves to other technicians that you work with. And I think if VetMed as a whole kind of gets rid of that toxic competitiveness, it just makes everything better. I've seen it so much in my time in the field of people just like feeling like they're better than everyone else and proving time and time again that they're better than other people. And it's not conducive with like a good learning environment. And ultimately, working in the field is a learning environment because there's so much knowledge to know and to like absorb, and things are changing literally day by day in the way that we practice medicine and the things that we're doing. And so just take those opportunities where you're feeling like, well, I need to prove that I know what I'm doing and that I'm better than this other person. Instead, maybe take a second, look internally, and tell yourself, how can I teach this person right now to better them in the future? Instead of proving that I'm better than them, I can help them better themselves.
Yeah. And I think that looks from an outward perspective far more impressive than just showing off ever will. Because then you've made an impact on the other person. Because then you've helped them
Mhm.
and you've taught them and you've spent a moment with them and you've connected with them. And that looks far more impressive outwardly than just saying, get out of my way, let me do this. You don't know what you're
Mhm.
doing. So just saying, like, that makes you seem like a better person. That's a leadership quality. It's not a bad thing to teach other people. And I will say, like, there were moments in my career when, shit would get to my head and I don't think I was ever a knowledge hoarder, but I think sometimes I could be a little like uppity about things where I would purposefully take a procedure or something because I just like didn't want the other person to do it. I felt like I could do a better job. And that's not fair to the other person. It might make me feel good in the moment to be like, "Oh, I can do it, don't worry about it." And I never like intentionally tried to make people feel bad about their skills, but like sometimes you just have to take a moment and step back. And I kind of learned that the hard way because I did see how it impacted people, or honestly, it impacted me. Like me choosing not to teach somebody over and over again because it was just easier for me to do it. What that results in is me having more work later on, right? Now I have to do
Mhm.
this, 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 and this instead of just these few things because I could have taught this person this one time how to do something and helped them and further them. Um, and then they could have helped me when, shit hits the fan and I don't have enough time to do all of the things by myself. So like that's
Mhm.
kind of how I learned like, hey, we got to like take a moment, slow down and teach these people so that I have more time and we can share the load amongst each other. And so it's just
Mhm.
I don't know, it's important to help others for sure. It helps you too, benefits you as well.
Period.
Yeah. But yeah, there's a lot of that in veterinary medicine. There's a lot of toxicity in veterinary medicine. I'm on Reddit all the time on like veterinary pages. And the one complaint I see most often from students in veterinary school is that they feel basically bullied by their classmates for not knowing enough, for maybe they didn't do well on a practical or an exam, or they couldn't contribute in a way that the team that they're working with thought they should have because it's hard. It's a very difficult program and everybody's going to adjust to it differently and every school teaches differently. But the one thing I see on there is they're like, I don't think I belong. I don't think I'm smart enough. My classmates don't think I'm smart enough. Or even the professors in some cases, who are most of the time veterinarians, can be cruel to some of the students if they're not picking up on things right away. And I just don't see how that helps the field or produces a better veterinarian. I really don't see that. So I think just making sure that you are not going to be that person when you get out of school and making sure that you're not that person in school that's making other people feel inadequate or dumb. It's just not fair because we're all going to have a moment. Every single person, whether you're the smartest person in the class or not, is going to have a moment where they don't understand something and it's not making sense. And no matter how much they study, it's not sticking. Everybody has that. It doesn't matter who you are, everyone has that moment. So it's just like, I don't know. Don't beat up other people for something that everyone experiences at one point or another. It's not fair. And I'm sure it happens in tech school too. I'm sure it does. I mean, it happens in every school. But I just think, again, it requires such competitiveness to get here that people have a really hard time dropping that, which I think is an issue. But
Because
I
essentially the
digress.
process of getting into vet school is like selling yourself essentially.
Yeah, it is. It's you proving to professors and other doctors and admission people that you're worth a spot. And there's so much you have to go through between just getting really good grades in undergrad. Honestly, brown nosing some professors to get letters of recommendation. There's like a lot that's involved in just applying. But yeah, if you made it that far, if you're in the program, you deserve to be there like anybody else. And it does not matter how you achieve it. If you get through it, and you pass the NAVLE, no one can say shit. Okay?
Period.
That's that. So do it however you need to do it, I guess. Don't compare yourself to others. Also, don't be afraid to take a break. I think there's so many people I see that, are sick when they come into class, they have a migraine, or they're just having like a bad like mental health day, they feel overwhelmed. It is okay sometimes to skip class. And I'm not saying you should skip class if it's going to impact your grade or if you're missing an exam or something very important. But seriously, it is not the end of the world if you miss a couple of classes. The world's not going to come to an end. You'll be okay. If you're really worried about missing class, chances are you're going to be studying if you're not sitting in that classroom anyway. So just take a break. If it means laying in your bed, doing your homework, and catching up and making yourself feel better, then lay in your bed and do that. It is okay sometimes to take a day off. And people who are just working in the veterinary field also need to hear that because I've worked with so
Mhm.
many who will come in like literally so ill. And I'm like, at this point, you're just spreading your illness. Get out of here and go home. Use your PTO time. That's what it's for. You do not need to be here.
Mhm.
It's okay to take a break sometimes. For the love of God, please do so. Like, I know when I reach my limit
Yes.
and I know when I need to take a day off. And I do. I do take that day off happily. And that is, I feel like another like a boundary that I had to learn the hard way in VetMed where I like wouldn't take days off. I'd work myself to death. I feel like we all did that at one point or another. And it's just not healthy.
Mhm.
So please don't do that. Take your days off when you need them. Who cares how that makes everyone else feel? Just saying. Let them.
Yes.
Let them be upset at you. Let them be annoyed. Let them say what they're going to say. You needed that day. That's okay. All right?
Oh my god,
Um
you just
the
rhymed.
other thing, did I?
Yeah.
I didn't even realize. Cool. Look at that. I'm a genius. The last tip I wanted to give is just that I think I find it very helpful because it is so overwhelming and there's so much content and there's so much happening to like set yourself a schedule for like studying, what days you're going to do what days you're going to take a break from studying because you also need to do that. I find that that is very, very helpful for me so that I can plan out my week. I know when I have my off time. I basically try to stay like 3 to 4 days ahead on like assignments and I use like time off to make sure that I can get ahead and stay ahead. And so I'll plan my week out. I have a planner where I like physically write in it all of the things I need to do each day, when I need to start studying for stuff. Friday afternoons, I do not touch my school. When I get out of class, we don't do homework, we don't do anything, we stay up late, we sleep in the next day. I still have to do homework obviously on the weekends, but I try to make sure that I like schedule a break for myself at the very least. And I also try to schedule not doing homework past a certain hour in the night. So I will not do homework past 9 p.m. I know there's a lot of people who will just stay up all night studying. If I don't know it by 9 p.m., that's it. Oh well, it is what it is. And I think having those boundaries and setting those boundaries is the only way to stay healthy. You need to sleep. You need to have like me time still. And that's important whether you're going to school or you're working in the profession. Like you have to schedule me time and you have to make sure that you're sticking with it for yourself. But yeah, I just wanted to talk about that because I do feel like there's a lot of just toxicity and like comparison and like so many other things involved in being in vet school. And I hate that. I think we should just be supporting each other and taking care of ourselves and learning. It doesn't really need to be any more than that.
Period. And all of the stuff that you just talked about is just kind of like the concept of having a routine, and routine specifically just in human nature is so important. Honestly, routine in general is important. I think we kind of forget that a routine is something that we actually, it's not just something that we've instilled as people, but we've instilled it as people because routine is a part of how the world functions, to be quite honest with you. Like, if you think about it, nature even works on a routine.
Yeah.
Like the seasons and how they change and the way that all of that kind of works together and ties together is something that we have kind of like taken upon ourselves as humans to instill in our everyday life because it just provides balance and allows people to kind of just like almost feel more at ease in everyday life.
Yeah.
Routine is just so important, and it's just been proven time and time again that it's an important part of life, and it helps keep you sane and make sure you
Yeah.
getting all your shit done.
Right. It reduces
So
stress, if
you should always
anything,
take
like
that.
just knowing what you're going to do
Yeah.
each week. Yeah. Yeah. Because again, like it is a very stressful program. There's no way around like the stress that you feel and like the pressure that you put on yourself. But at the same time, there are ways to make it more manageable that I think people overlook. Or maybe I know it takes an extra like 30 minutes a week to sit down and plan out your next week and go over everything and look at your schedule and make sure that you're ahead on your assignments and all of that. But like those 30 minutes, like, make my entire week less stressful, easier to manage. I know exactly what's happening every single day, and I don't feel worried about it because I've planned ahead. And maybe that's just the OCD in me, but it just helps so much to just not be like chaotic and, look at your phone at 9 p.m. Oh my God, I don't even know what classes I have tomorrow. Let me look at the schedule. That to me is like, that is just going to make it so much harder on you. If you're just like rushing around and you don't know what's happening and you're behind and, life happens and shit happens. And I'm sure that will happen to me eventually where I'm running around and I'm behind and I don't know what the fuck's going on because life happens and that's okay. But I think in general, if you can stick to that, it's very helpful. Okay. We'll go ahead and do our chaos corner for the week. Mine is not VetMed related, but it's still a little bit chaotic, I guess. Found out in the last few weeks that type 2 diabetes like strongly runs in my family. I now have two siblings, I think, that have it, a grandparent that had it, and just other people who are pre-diabetic now in my family. And so I kind of like have been panicking about that a little bit. I've been like hardcore working out and like trying to eat better. And I'm so sore every single day that I can barely move around. And I'm just low key suffering because I'm scared now of getting diabetes. So anyway, that's my chaos corner. I'm like really stressing about it. Like you can ask my boyfriend. He's like, "Girl, you need to calm down about this." He's like, "We don't like eat like that badly. Like we eat fine." But I'm just like panicking about it a little bit. So that's my chaos corner.
Okay, so my chaos corner this week is just going to kind of be related to our topic a little bit. I kind of wanted to tie it in. I had an experience working at a clinic one time where I had placed a nasogastric tube in a patient. I think it was like a parvo dog or something. For those of you who don't know, nasogastric tubes is just like a tube that goes through the nostril and into the stomach. We use it a lot for pulling off residual volume out of the stomach if that's necessary, as well as like feeding through them. And essentially, when you place an NG tube, it also has to be tacked down into place. I had placed this nasogastric tube. It was not my first time. I've been in the field. I know what I'm doing, but I was fairly new at the clinic that I did it at. And essentially, a technician had complained that I didn't place it appropriately or it wasn't tacked in appropriately. And it's just like goes back to the whole toxic workplace and the proving that you're better than somebody else. One thing that I hate about VetMed specifically is this like need to be right that people sometimes have, and the fact that people can't seem to grasp that there is multiple right ways to do one thing. Just because the way I did it is different than the way that you do it does not make my way wrong. It still serves its purpose, it still has its function. And so that's kind of my chaos corner. It's just being told basically that I didn't do something appropriately when I did it just
Did
fine.
she
And
place
I've been doing it.
like was she helping you place it? This person? Okay. Because I was like, why wouldn't they just bring it up like in the moment if it was bothering them? But that makes sense if they weren't in there.
No, it was just one of those things where it's like they saw how I tacked it in place. They didn't like the way I did it, therefore it's wrong. Ugh, and that type of behavior just frustrates me.
Yeah. Yeah. That's understandable. I've seen very similar things. And like again, sometimes the way that people do things can be frustrating if you feel like it is more difficult to manage or whatever when you're dealing with a patient, like if you're in ICU. And so like I can see it. But at the same time, she could have come to you and been like, is there a reason why you do it differently? Can you explain to me? And like maybe she would understand a little bit better why you do it the way you do it or what the purpose behind it is versus like just talking about it or going to management about it. Because if it's not like harming the patient and like you said still serving its purpose, I don't really see a point in going to management. I think that's just like intentionally causing drama when they could have easily resolved that with you. Yeah. Yeah.
Well, sometimes there's just not even
And
a
like you said,
resolution that needs to happen.
well, yeah, and in that case, again, unless it was harming the patient in some way, what is management going to do differently? Nothing. Unless they decide that they want to have like a certain standard, everybody has to do it the exact same way as a hospital, like nothing's going to come out of that.
So,
But, oh well,
whatever.
I'm sorry that happened to you.
It's whatever.
But with that being said, don't be toxic, don't knowledge hoard, set boundaries, and take care of yourself in the same way you take care of your patients.
Love you guys.
Bye.
Bye.